Hi everybody, my name is Dr. Andre. I'm a urogynecologist, and what I want to go over today is the management of pelvic organ prolapse. So pelvic organ prolapse is the descent of pelvic organs into the vaginal canal. So the pelvic organs in question will be, for example, the bladder falling into the vaginal canal. That would be likely a cystocele. The top of the vagina or uterus falling into the vaginal canal. That would be, for example, a uterovaginal prolapse. And the rectum falling into the vaginal canal. That would be called a rectocele. In the management of pelvic organ prolapse, there are really three options that we give patients. So the first option, if the patient is not bothered with it, for example, in a circumstance where they're seen by a primary care provider and the primary care provider says, oh, you have a bulge in the vagina, and the patient says, really, I didn't know that. And in that circumstance, the patient is not bothered with it and there are no complications from it, it's really reasonable to say, hey, there's really nothing to do and you're okay with it. You can live with it. It's not going to cause necessarily any harm for you. That's one option. The other option would be, another conservative option would be offering the patient a pessary. A pessary is actually a commonly placed device. It's a silicone dish usually. And what it does is it's placed into the vaginal vault and it suspends or supports the pelvic organs. There are different types of pessaries. There are two categories. One is called support and the other one's called space occupying pessary. So this is a support pessary. What it does, this is called a ring with support. Pretty much it's folded and placed into the vaginal vault and it kind of just relaxes there and keeps the pelvic organs up. Sometimes they have little knobs on them. These little knobs can actually support the urethra in the case that a patient has loss of urine with coughing, sneezing, laughing, those circumstances. That's called stress urinary incontinence. Other types of pessaries called space occupying. There are two types. There are a few types. One of them, this is called a Gellhorn, has this stem. It's placed into the vaginal vault and it supports more extensive prolapse usually. Another type, it's called a donut pessary. So these are some conservative options, the non-surgical options that can be used to treat pelvic organ prolapse. Very important to be aware of these options. In fact, when we counsel our patients, we inform them of three options. Again, you can do nothing. Pessaries are a reasonable option. And the third option for the right candidate would be surgical options, which we'll discuss at a later time. If there are any questions, please give us a call. Again, my name is Dr. Andre, and I'm a urogynecologist.